Yes, thank you so much. We are talking about today Carvenous sinus thrombosis. Carvenous sinus thrombosis can come as a result of many causes, but for today, we are talking about it as an origin from dental infections. First of all, we shall begin by saying blood is always drained from the brain through veins, but it goes to the brain or supply the brain with oxygen, with nutrients through arteries, and drained, of course, by veins. When it is drained by veins, it is joined into bigger veins, the ones we call venous what? Sinuses. Of course, which now also join into the bigger one, the jugular vein, which goes to the what? To the heart. So, we shall say that when we have cavernous sinus thrombosis, it is always as a thrombosis or a blood clot forming around or in the cavernous sinus. But what is this cavernous sinus? It means that this one is a bigger sinus, or it is a bigger vessel where we should be having some parts of the body, some blood vessels passing through. What are these blood vessels? Number one, in this cavernous sinus, lateral to it, we have the ultramotor nerve, the third cranial nerve. We have the trochlear nerve, the fourth cranial nerve, lateral in the sides. We have the fifth division of the what? Trigeminal. So all these ones are in the sides. Inside it, we have the internal carotid artery passing through this cavernous sinus. We have the abducent nerve, or the sixth cranial nerve. I will not go into functions, but all these ones are passing, this one and this are passing through the cavernous sinus. So it is very important. But now, we are talking about as a result of dental infection. Because remember, we're talking about consequences of what? Of infections. So, this one, when we have blood, when we have infection in the head or in the tooth or a pimple or any other cause where infection is spreading through the skull. Of course, in the skull there is a brain. We are most likely to have cavernous sinus thrombosis. How does it come? Usually, in other parts of the body, we have blood, we have lymph nodes as the immune system. But in the brain, we have no lymph nodes. Whereas you get a problem here on your finger, and all of a sudden you develop a pimple in your armpit. You develop a lymph node in your armpit. Lymph nodes are always in all these joints, even in the heart, and the immuno region can have what? Lymph node. Even in the armpits can have lymph node. Inflamed, because the immune system is making it to stop the infection or to prevent infection from spreading to other parts of the body. But what happens to the brain? We do not have what? Lymph node. So what happens is the body mechanism, the body itself, when it's going to form a blood clot, when this blood clot is formed, of course, remember this area here is supplied by what? Is by all the veins are returning blood here. It's going to increase pressure. All the veins are turning blood through the what? The venous sinus. The pressure will increase. After pressure increases, this is what is going to produce stroke-like symptoms. What are stroke-like symptoms? We can easily get headache, strong headache, and most of the signs and symptoms shall get are going to be coming from what? The eyes and the face, where the blood is supplied from. Things like blurred vision, confusion, loss of consciousness, loss of what? Control motor, seizures, what? Periorbital enlargement. We have fixation of the eyeballs, dilated pupils of the eyes. All these ones are going to be the signs of what? Symptoms of cavernous sinus thrombosis. Because a blood clot is formed by the body itself to stop the infection from spreading. When that is done, pressure increases. And when the pressure increases, you can easily have a rupture of any of these veins. And whenever it ruptures, we can have all this. But remember, this one is a very slow process. Can even it is not like the one in arteries. This one can take from days to months. But it is an emergency. So how do you diagnose this? You can diagnose by MRI or CT, MRV. All these ones can be the one to tell you. So when these ones diagnose it, but first of all, which people are at a risk of getting cavernous sinus thrombosis? People with inherited blood disorders, people with cancers, people with pregnant mothers, people on medication, on chemotherapy, people who are using birth control pills can have this. So majorly, when this one is done, we can give antibiotics here and coagulants. Usually we give, depending on the condition, heparin, IV, then also warfarin. Sometimes we can, depending on the situation, it can take so long, something like 6 months. And for some people with already disease, blood disorders, it can even be for a very long time, if not lifetime. In cases where it may be so complicated and may need surgeons, we can always refer to neurosurgeons to have better treatment of our patients. Thank you so much for watching. Thank you so much. I encourage you to subscribe and share our videos. Thank you.